Hello, I'm Dr. John Oyston, and welcome to my presentation on the relationship between capitalism and public health. Let's begin with some definitions. Capitalism is a social and economic model based on the private ownership of business, with the goal of making the greatest possible profit for the business owners. Public health is about protecting and improving the health of people and their communities. It has the goal of preventing injury, illness, and premature death. These value systems are obviously in conflict. Capitalism values individual freedom and personal responsibility, and it leads to innovation, productivity, and wealth for some people. Public health, on the other hand, puts the good of the community before individual rights and is searching for the greatest good for the greatest number. We need to control capitalism in order to promote public health. Uncontrolled capitalism leads to bad working conditions, low wages, unsafe products, pollution, global warming, disease, and death. If you want more information, Bernie Sanders has written an excellent book. In civilized countries, we try to control capitalism with laws on workers' rights, product safety, and environmental protection. But currently, capitalism is not being well controlled, and this imbalance is bad for public health. So let's look at the response to a product that's found to be dangerous. Under capitalism, you would sell the product anyway, and there'd be competition between different products, some of which might be safer than others, and consumers choose what they want to buy. In public health, you would find substitutes for dangerous product and aim to ban the sales and stop the production. So let's look at asbestos. This was declared a carcinogen by the WHO in 1987. By 2011, Canada had closed all its asbestos mines, and in 2018, Canada banned the use, sale, and export of asbestos. So it took 31 years to go from scientific discovery to regulations that prioritize public health over corporate profits. But we got there in the end. If you look at cigarettes, however, they were declared to be a cause of lung cancer by our health minister in 1963. The latest figures I could find, in 2013, Canada grew 55 million pounds of tobacco, and in 2022, we manufactured 1.5 billion cigarettes. So after 60 years, Canada is still ignoring the science and the morality by failing to ban the growing of tobacco or the manufacture of cigarettes. So what are our approaches to cigarettes? We're looking at a form of controlled capitalism. We have restrictions such as age limits, advertising bans, warning labels, and taxation. If we wanted to adopt a more public health approach, we might limit its sales to certain locations. We might raise the age to create a smoke-free generation, or we might look at substituting safer products with the idea of reducing or eventually eliminating the production of cigarettes. Is our current approach working? Well, it is to a certain extent. Certainly, nobody gives cigarettes as a Christmas present anymore, and our smoking rate is declining. But still, over 8% of Canadians smoke, and this causes 4,000 unnecessary deaths every month. Where could safer nicotine products fit in? Well, from a capitalist point of view, they could increase the size of the nicotine market. They might be serving as a gateway to tobacco, and you would want to encourage dual use or switching, and you would want to avoid people quitting nicotine altogether. But from the public health point of view, you would see them as safer alternatives for people who smoke, and you'd want to ensure that there's proper information, adequate nicotine content, a reasonable range of flavors, and taxation that was proportional to the risk. So how should vapes be sold? In uncontrolled capitalism, you would be able to sell them to everybody, everywhere, and you would want them to have a high nicotine content to make people addicted. You would prefer pre-filled pods because this locks the customer into your brand, and you would like disposables as a cheap entry mechanism for young people. From a public health perspective, you might think that only smokers should be allowed to buy and use vape, and that they should be distributed via medical channels and perhaps by licensed vape shops. And you would prefer refillable pod systems because these give you a large range of nicotine concentrations and flavors, the lowest overall costs, and the least environmental pollution. You might also want a medical grade vape. This would be industry innovation in the aid of public health. A vape made to medical standards would be easy for MDs to recommend and prescribe, It would be a trustworthy choice for consumers. It could be sold in hospitals and pharmacies, and it could be covered by health insurance. However, in Canada and the UK and New Zealand, governments haven't been able to get industry to invest and produce such a product. And it makes me wonder, are tobacco companies really serious about quitting smoking? Juul is an example of excellent innovative technology and design, and Clive Bates said it was the most successful anti-smoking device ever made. If PACs had decided on a public health approach, they would sell it as a tool for smoking cessation, and they would have a market of 1.3 billion people who smoke that they could sell the product to. But they went for uncontrolled capitalism, and they decided to sell it as a fun gadget for youth. And I think this was very unfortunate. Looking at disposables, this might be an example of harmful innovation because they're being sold cheaply to kids. SpongeBobVape.com uses a cartoon character aimed at 6 to 11-year-olds to sell disposable vapes. Disposables also create waste and environmental pollution. From a public health point of view, you might want to ban them altogether, but they are simple to use and popular with some adult smokers. You might want to have a high refundable deposit to encourage people to return them, or you may sell them in multi-packs of maybe 5 to make them less affordable to youth, the same way that many countries ban the sale of single cigarettes. Heated tobacco products in capitalism would be sold to everybody regardless of their smoking status. They would be good because they keep consumers using tobacco, and you'd want to encourage dual use, so people use heated tobacco products in public and cigarettes at home. From a public health point of view, they should be the fourth choice for quitting after cold turkey, nicotine replacement therapy, and vape. They should only really be used by quitters who want the tobacco taste and experience, and these people should switch completely to using HTP. Academic publishing is actually a brilliant example of capitalism, because they managed to get away without paying the authors or the reviewers of their scientific papers. They seek publicity to maximize profit, and this leads to publication bias, the overstating of conclusions with clickbait headlines, bad science, and in some cases outright fraud. Academic conferences are also a form of capitalism. They run as a business. And in Canada, some smoking cessation conferences are funded by the manufacturers of medical nicotine replacement therapy, which is interesting because vaping is in direct competition with medical nicotine replacement therapy. And these conferences ban people with any connection to vaping, even vape store owners, from ever attending the events. Charity should be a safeguard against capitalism, but in fact, in this field, there are examples of uncontrolled capitalism. Bloomberg gave the WHO $1 billion for tobacco control, so a billionaire can use the WHO to promote his personal anti-vaping bias. The Truth Initiative has assets of almost $1 billion, and with very limited oversight, they're free to distribute their anti-vaping propaganda. Thinking about the end game, from the tobacco industry perspective, they would want to sell as many cigarettes as possible to create a war chest. They would want to support the government financially with taxes, fines, such as the Master Settlement Agreement, and campaign donations to make governments rely on industry funding. They would want to extend into vape, HTP, and oral nicotine to retain their nicotine consumers. And they would resist change by casting doubts on the safety of competing products, encouraging nicotine caps and flavor bans. If they wanted to be more in line with public health, they could do what PMI tried to do and diversify away from tobacco. But when PMI bought a company that makes inhaled asthma medicines, they were roundly condemned by the Canadian Lung Association. And when they funded the development of a plant-based COVID vaccine, this vaccine was rejected by the WHO only because it involved tobacco industry funding. If you look at the end game for the makers of medical nicotine replacement therapy, they face threats as fewer people smoke, and quitters prefer vape to medical nicotine replacement therapy. They need to preserve their market share, so they should work with anti-tobacco groups and government to promote NRT as the only method to quit, and they should ban pro-vaping voices at tobacco control events. From a public health perspective, they should branch out to consumer nicotine products such as nicotine pouches and vape. Looking at the end game for tobacco control groups, they might want to keep their income and jobs in a capitalist system, keep the organization intact, and therefore transition to an alternative goal such as nicotine control, which Physicians for a Smoke-Free Canada has done. From a public health perspective, they should celebrate their success, they should leave a small monitoring group in place, and they should move on to other issues. Thank you very much for your attention. If you have any questions or comments, you can email johnpoyston@gmail.com, and you can read more on my blog at johnoyston.com. Enjoy the rest of the conference.